Zygomatic bone are paired facial bones. They are quadrilateral in shape. They have three surfaces. They are the lateral malar surface, which forms the prominence of cheek. The word malar in Latin means the cheek. The, the superior orbital surface, which forms the lateral wall of the orbital cavity as well as the floor of the orbital cavity, and the medial temporal surface, which forms the anterior boundary of temporal fossa and infratemporal fossa. Has five borders. The anterior-superior border separates the lateral surface from the orbital surface. The anterior-inferior border articulates with the maxilla. The posterior-superior border is in the shape of letter F. The posterior inferior border is free and continues as the lower margin of the zygomatic process. And another one is the posterior medial border. Posterior medial border, upper part articulates with the greater wing of the sphenoid bone. Middle part forms the margin of the inferior orbital fissure. The lower part articulates with the orbital surface of the maxilla. Zygomatic bone has two processes. Frontal process, which articulates with the zygomatic process of the frontal bone, completing the orbital margin. And another one is the temporal process, which articulates with the zygomatic process of the temporal bone, completing the zygomatic arch. Determination of side can be done by 2 points. The lateral surface is convex and the posterior superior border is in the shape of letter F. Lateral surface presents zygomaticofacial phenomena. Zygomaticofacial phenomena transmits zygomaticofacial nerve, a branch of maxillary division of trigeminal nerve. Zygomaticofacial phenomena transmits zygomaticofacial artery, a branch of lacrimal artery. Lateral malar surface gives origin to zygomaticus major. It also gives origin to zygomaticus minor and levator labii superioris. Orbital surface presents the zygomatico-orbital phenomena which communicates with the zygomatico-facial phenomena and zygomatico-temporal phenomena. Medial surface presents zygomatico-temporal phenomena which transmits zygomatico-temporal nerve, a branch of zygomatic nerve, and a zygomatico-temporal artery, a branch of lacrimal artery. The zygomatic arch gives origin to masseter muscle. Two types of fractures are observed in the zygomatic bone. Arch fracture. In arch fracture, there will be palpable bone defect over the arch. Depressed cheek will be there with tenderness and pain in the cheek region and limited mandibular movement, and patient feels pain during opening the mouth. Another type is the tripod fracture, which involves three areas: the zygomatic arch, the zygomaticofrontal suture, and the inferior orbital rim and floor. The clinical findings will be periorbital edema as well as hyperesthesia of the infraorbital nerve, and palpation may reveal step off as well as the global injury